Hello, my name is Jolene Burkale, and I am the Student Health Services Specialist at the Indiana Department of Education. I would like to welcome you to this COVID-19 informational webinar for staff. COVID-19 is a novel coronavirus that has never been seen in humans before. Symptoms generally occur 2 to 14 days after exposure to the virus. People with COVID-19 have reported symptoms ranging from mild to severe. Older adults and people who have severe underlying medical conditions such as heart disease, lung disease, or diabetes appear to be at a higher risk for developing more serious complications from this illness. The virus is thought to spread mainly from person to person through respiratory droplets produced when an infected person coughs, sneezes, or talks. These droplets are expelled into the air and can be inhaled by people who are nearby. COVID-19 can also be spread by people who are infected but are not showing symptoms, and from people touching infected surfaces and then touching their own mouth, nose, or eyes. Let's watch a quick video explaining these concepts of how the virus spreads.
We believe this new virus spreads mostly from person to person through respiratory droplets produced when someone who is sick coughs or sneezes. This is similar to how flu and other respiratory illnesses spread. These droplets can land in the mouth or nose of people nearby, or possibly be inhaled into the lungs. Most person-to-person spread happens when people are in close contact. It's also possible that this virus can spread when someone touches a contaminated surface and then touches the mouth, nose, or eyes.
There's currently no vaccine to prevent COVID-19. The best way to prevent illness is to avoid being exposed to the virus. You can do this by staying 6 feet apart from others, washing your hands or using hand sanitizer often, wearing a face mask, disinfecting frequently touched surfaces, avoiding touching your eyes, nose, or mouth, and staying home when you are sick. Let's take a closer look at each of these mitigation strategies. Keeping space between you and others is a key tool that you can use to avoid being exposed to this virus and slowing its spread locally and across the country. Limiting close contact with others outside your household is important since people can spread the virus before they know they are sick. Social distancing is especially important for people who are at a higher risk for developing severe illness from COVID-19. Hand washing is one of the best health practices a person can do to stay healthy and prevent the spread of disease to others. Wash your hands before touching your eyes, nose, or mouth, before eating, and after blowing your nose, coughing, or sneezing. Clean hands can stop germs from spreading from one person to another and from spreading germs from your home to your work environment. Follow these 5 steps every time you wash your hands. Here's a demonstration of how to wash your hands. Be sure to scrub your hands for at least 20 seconds.
Try and avoid sneezing into your hand because you just contaminate them and then spread those germs everywhere. Focus on sneezing into your elbow, like this, and then you don't contaminate your hands. Turn on the water, wet your hands, apply a good amount of soap and lather up, and then focus on washing your hands for about 20 seconds, about the time it takes to sing Happy Birthday twice. Focus on washing the front of your hands, the back, in between the fingers, around the nails, and so on. And then rinse everything off. Use something to wipe your hands after that, preferably something disposable like a paper towel, and then use that to turn off the tap as well. If you get a chance, use that to also open the door to the bathroom as you're leaving. The best way to wash your hands is using running water and soap, but sometimes we don't have that available. So think about carrying with you a hand sanitizer. That should have at least 60% alcohol content.
For more information, visit www.cdc.gov or call 1-800-CDC-INFO.
If washing your hands with soap and water is not possible, using a hand sanitizer with at least 60% alcohol can reduce the number of germs on your hands. Remember to rub the gel over the surfaces of your hands and fingers until your hands are dry. This should take around 20 seconds, the same as if you were washing with soap and water. Since people can spread COVID-19 to others even when they do not feel sick, everyone over the age of 2 should wear a cloth face covering when they go out in public. The cloth face covering is meant to protect other people in case you are infected and to stop the spread of disease. A face covering should be worn the entire time you are in public except for eating or drinking. It is important to remember to wash your hands or use hand sanitizer anytime you touch your face covering. After you have washed your hands, put the covering over your nose and mouth and secure it under your chin. Try to fit it snugly against the sides of your face. Make sure the covering is comfortable and that you can breathe easily. When removing your face covering, make sure to touch only the ear loops or ties. Fold the outside corners together and be careful not to touch your eyes, nose, or mouth when taking off the face covering. It is important to wash your hands immediately after you remove the covering. Limit the sharing of items such as art supplies, sports or playground equipment, and electronic devices as much as possible. If items must be shared, limit them to one group of students at a time and clean the items between use. Clean and disinfect frequently touched surfaces daily. Follow the instructions from the manufacturer regarding cleaning electronic equipment, or use alcohol-based wipes that contain at least 70% alcohol to disinfect touchscreens. Remember to dry all electronic surfaces thoroughly. Monitor your health and be alert for symptoms. Take your temperature daily, but don't take your temperature within 30 minutes of exercising or after taking medications used to lower your temperature. If you become ill, stay home and take care of yourself by getting a lot of rest and staying hydrated. Keep in touch with your medical provider, especially if you are having trouble breathing or if you have symptoms that are severe or that are concerning to you. I heard a CDC expert compare the strategies used to slow the spread of COVID-19 as being similar to layering several slices of Swiss cheese together. If you use only one strategy, you will still have holes in your plan. As you layer more and more strategies together, you significantly diminish your chance of spreading the virus. Let's review these strategies again by watching this video. The symptoms of COVID-19 include fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, loss in your sense of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. Many times a person that is ill with COVID-19 does not experience just one symptom. They will typically have several symptoms, and the most unique symptom would be a new loss of a person's sense of taste or smell. The CDC has a webpage that contains recommendations to help adults have conversations with children about COVID-19. Key tips from this webpage are listed on this slide and include remaining calm, being reassuring, listening, reducing screen time, and providing truthful and appropriate information. The CDC also has a variety of printable materials that are free to download and print. These resources can be posted in visible locations to promote everyday protective measures. The website for these CDC resources, as well as many other CDC resources, can be found on the Indiana Department of Education COVID-19 webpage under the COVID-19 Health Educational Resources section. Several Indiana state agencies collaborated in creating the in-class COVID-19 health and safety reentry guidance documents for schools. This document is intended as a guide and can be viewed on the department's COVID-19 webpage. Districts and schools are encouraged to communicate with their local health departments and review the CDC recommendations to aid in their decision-making process. In-class includes checklists and guidance suggestions on a variety of topics. As COVID-19 is a constantly evolving situation, this document is updated frequently and includes a change log at the end of the document. Schools should use in-class as a guidance document, but each school will need to determine their own policies and procedures related to COVID-19 in collaboration with their local health officials. As such, schools should always check with their own administration for specific guidance. Several resources are listed on this slide and include the Center for Disease Control and Prevention, the Indiana State Department of Health, the Indiana Department of Education, and the in-class document. As we face the start of an unprecedented school year due to the COVID-19 pandemic, please know that the Indiana Department of Education thanks you for all of your tireless efforts on behalf of our Indiana students. I want to wish each of you a healthy and a safe school year.